Now, there's been a proposal to set up an AIDS Foundation in Singapore. The Communicable Disease Center, or CDC, says this, and a HIV molecular epidemiology laboratory is one of the several initiatives that are being looked into. Tonight, video journalist Paul Force brings you the first of a four-part exclusive report on Singapore's fight against AIDS.
The high cost of antiretroviral drugs to treat patients with AIDS is said to be one reason why some are reluctant to get themselves tested for the HIV virus. Currently, most new AIDS patients have to wait over a year to get financial help with their medication from the CDC. The only other support comes from the Action for AIDS Endowment Fund, which helps needy patients.
We are hopeful and thankful to the ministry who is willing to look into the establishment of AIDS Foundation. With the availability of care and accessibility to the medications, more people will be more willing, I hope, to get themselves tested.
In countries like the United States, AIDS foundations are sponsored by corporate and other private donors, and they fund a wide range of programs, from financial support for patients and their families to outreach programs and even AIDS research. The proposal for an AIDS foundation here is still being looked into, but one thing's clear: corporate support will be greatly needed if it's to take off. Aside from financial support, social services are also slated to expand.
There are not enough social workers at the moment because we have almost like 1,500 patients, and the work is very much more intensive than the usual work that we see. We see them for a long period of time, from the time they're diagnosed until the time that they pass away.
So the CDC will increase its social workers from the current 4 to 10, so that a new public health program called Positive Prevention can be pushed out. This aims to modify the behavior of HIV-positive patients through intensive counseling, so they will not spread the disease. Another project in the pipeline, the setting up of a HIV molecular epidemiology lab like this one, which would cost the CDC at least $500,000 Sing dollars. The lab would study the strain of HIV virus Singaporeans have contracted, and comparing it with HIV infections in other countries, scientists hope to trace where the patient got infected, and from there inform regional health workers on mapped out places of intense transmissions. Currently, in the region, HIV molecular epidemiology is carried out in Thailand, China, India, and Japan.